We want to talk a little bit about preparing for surgery. So surgical procedures need a little bit of planning in advance. So number one, medications. Many of the medications that you take, we actually want you to continue all the way through. That one example would be blood pressure medications. Blood thinners are usually to be avoided for a period before the procedure, especially aspirin, because it takes about 2 weeks to wear off. And oftentimes we'll want you to check with your primary care physician just to make sure you have clearance to stop medications such as blood thinners. Number two, over-the-counter medications or supplements. A good example would be herbal supplements. So many of these are okay, but some of them are actually blood thinners. So we want to make sure that if you are taking one of those, that you also stop that a week or so in advance. Number three would be alcohol and smoking. So alcohol does have a blood thinning effect. So ideally, we want you to stop any alcohol a week or so in advance. Smoking is also a problem with many surgeries because it will make healing more difficult. So we want you to stop smoking at least 1 week, if not 2 weeks in advance. Number four, we will ask you to get prescriptions for certain medications such as antibiotics or topical antibiotics such as bacitracin to use during the recovery period. We may also ask you to get ready for doing some compresses on the skin if we're doing a laser resurfacing. So this is another thing you want to get in advance. Number five, there are certain clinical studies that we often ask for. One of those is blood tests to make sure that you have normal coagulation, normal platelet count. Another might be x-rays, especially a mammogram if we're going to be doing a procedure on the breast. Number six, many procedures require the use of sedation. So this will make you sleepy and is not safe to drive. So you want to make sure that you have arranged for a ride home. So number seven, we will provide you in most cases with a instruction sheet that summarizes, everything that should be done before the surgery. This might include certain dressing materials for skin care and also garments that might be used for providing compression after liposuction.